Assalamu alaikum and welcome to Parenting Hour. You're tuned into Unity FM 93.5 here in the West Midlands and 105.1 if you're tuned into us on Inspire FM in Luton and Milton Keynes. Welcome to this evening's show. We have got some wonderful guests that are coming back to us again. It's great to see familiar faces back here again, getting information out about vaccinations and the changes that happen and the importance of vaccines. There's a lot of information. Every time we do this show, there's so much information that I get very confused. And I'm sure listeners, you get very confused also because there's so much information there to unpack. And as our children grow up, we only tune into kind of those specific bits we need at that time. And then we tune out of the rest of it. So today we are talking more about vaccinations with two experts, mashallah, to give us that information so you can tune in and home in on what is important for you and your child or children's age and learn about different vaccinations or as an adult also, inshallah. We've got Yasmin with us. Assalamu alaikum, Yasmin, and Sharen with us. Welcome, Sharen. Mashallah, I can see them. I'm sorry, our listeners, you can't see them, but it's great having them back. Welcome to this evening show.
Thank you.
Thank you, Kathleen.
You're welcome indeed. Let us start with a little bit of introductions around yourselves and who you are and what you do and what your day-to-day working job like.
So, assalamu alaikum to everybody, and I'm Yasmin Shakeel. I am a service manager for the school age immunisation service, working under Birmingham Community Healthcare Trust. And I have with me Sharen.
Hello, I'm Sharen Bant. I'm one of the team leads or clinical manager for one of the bases for Birmingham Community Healthcare Trust. I'm based in the Lansdowne Health Centre in Winson Green, but we do cover all of Birmingham and Solihull.
Thank you so much indeed. Can we just start at the very beginning of what is school age immunisation service? What is it? What does it look like? Give us a little bit of background to kind of put all of this into context, please.
Thank you, Kathleen. So, school age immunisation service is an NHS free service to all children of school age. So, this is a nurse-led service offering routine scheduled vaccinations in schools across Birmingham and Solihull. The service is delivered by qualified nurses and support staff who have specific training to support any challenges whilst vaccinating. So the purpose of today's show is to promote school age immunisation service and to share important messages and to do some myth busting to improve the vaccination uptake.
And is there a problem with that vaccination uptake that you have to kind of, we've talked about this before and we've talked about this continuously. I presume there's a need there to keep talking about it.
Yeah, there is definitely a need to keep talking about it because there is a lot of vaccine hesitancy. And what we are trying to do is to give the right messages to the community to make that informed decision on having the vaccinations and to consent for vaccinations for their children. So this is a really good opportunity for us to link in with our community and to actually do some myth busting and to improve the uptake of vaccinations.
Yeah, and so people are still worried about vaccinations. I suppose it's maybe difficult this evening because this is a pre-recorded show to ring in live. But if you are listening to this, listeners, and do have a question or a worry, please do ring in the studio. Our studio managers are there. They will take your questions and we will forward those questions on to Yasmin and Sharen so that they can answer them and give you back the proper answers and the correct answers, the correct information for you. It sounds like there's a lot of misinformation happening around vaccinations. Wonder why is that? What is our current, maybe people don't understand the range of vaccinations and what is our current program, what is the schedule, what did it look like so far. There's so many things from birth up. How can we help them to understand all of those vaccinations?
So, if I give you a little overview, then, Kathleen, of
Appreciate,
what
thank you.
the academic year looks like for us.
Mm.
So, we kind of break it down into three parts for the three main vaccinations that we give. At the moment, in the summer term, which we would say is from April to July, we're looking at what we call the Teenage Booster Program. So, this is vaccinations that you've had as a baby, your diphtheria, tetanus, polio, and your meningitis. You would have those at 8 weeks, 12 weeks, 16 weeks, and then again just before you go to school. So about 10 years later, where we come in for year 9, your immunity to these diseases is starting to wear off. So we come back in with a booster dose. So they're not new vaccinations, but they're your booster dose of the ones that you would have had as a baby. They can cause meningitis, they can cause septicemia, and there's a lot of talk in the news at the moment about meningitis, but it's the meningitis B strain, not the one that we actually cover as a teenager. But it is important that teenagers are protected. So we offer these vaccinations in year 9, and we also offer them to any child in year 10 or 11 or 12 if they've missed their vaccinations. We can also give them to children in clinic. And then after we've had the summer term and we have the school holidays for summer, then we come back in September. And for the winter season, or from September to December, possibly on into January, this is where we look at our flu program. The flu program is slightly different in that it's offered to all children in Birmingham and Solihull. So from age reception in primary school all the way up to year 11 in secondary school. And we deliver that to all pupils across Birmingham and Solihull in all primary secondaries and in any of the specialist provisions or in special schools. This is offered to all children. Throughout the winter period, to try and decrease winter pressures, we also offer clinics on a Saturday or evening clinics, just to help parents that are at work, and if they've consented for their child to have the vaccine, and for whatever reason they might have missed it at the school session, if they're ill or if they're on a school trip or anything like that. It's just to help people out to have the vaccinations that they want to have.
Mm.
And then after the flu season, between January and Easter time, usually we have the HPV program. And this is to offer the HPV vaccination to boys and girls in year 8. Optimum to give it around that age and 1 dose to get the best immune response to the HPV virus. Clinics, we can also offer vaccine to anybody up to the age of 25, provide they meet the eligibility. The vaccine was originally mainly aimed at girls and for cervical cancer, so the program for boys didn't start until about 2019. So we can offer it to both as long as they're in the right age group. Alongside our vaccinations, aside from the flu, we also offer an MMR, measles, mumps, rubella catch-up program. And this is for any children that we can see have missed either one or both of their doses of that vaccination. Possibly they're new to country, or they just didn't have them as a child. So we will offer that as a catch-up alongside. Also as part of our team, but not as part of the school age program, we also offer the BCG, the TB vaccination to any neonates who are eligible for the TB vaccination. And we also run the Hep B, hepatitis B service across the city. And this is a home visit, domiciliary type visit, where we actually go into the parent's home if they're tested positive for hepatitis B in pregnancy, and we offer vaccinations to their child, and then a blood test at the end of the doses at 18 months just to check for any disease.
That's so much information. Thank you, Sharen. I mean, it's no wonder that parents get confused because obviously you know this and tap of your fingers and you're going through it so easily. But for parents, there's a lot in there. You know, there's a lot to remember. There's a lot to dates. There's a lot of different times, different ones for different people. How do they remember each one of these? How can they kind of keep it structured in their mind? Are they sent out reminders, notices? or what's happened? They frame that easier?
So we use an electronic system called Mavis, managing
Oh,
vaccinations in schools, but
mm,
the acronym is actually Mavis, and that's how we like to remember her. But we use a system called Mavis for electronic consents. And when we know we're going into a school on a particular date and the school have agreed, we will set up a session online, and Mavis will send the details out to the parents saying what vaccine we're giving, what year group it's for, what the cohort is. And there
mm,
will also be links on there to various information about the vaccine itself. So parents can do some reading around the subject before they either send in a consent or a refusal, depending on their choice.
mm.
Then maybe send reminders to anybody who hasn't engaged at time points before the session, usually a week before and 3 days before. Parents are busy. It's just a little reminder if you
Mm.
haven't consented and you'd like to do so. There's also an option to tick on there that you'd like a call back from us if you want some more information or you wanted to talk about anything specific.
Great, because that was what I was just going to ask you next, actually. But some parents might have a query or feel, I want to do this, but they have make associations, and I think we're going to talk about some of those associations in a few minutes, about different things, that rumors that goes around and things like that. But they just want to talk that through with a professional first, because we know that it's like Chinese whispers. Like, I just got a message this morning from somebody about something that they heard, they thought I did, which I don't do at all, because somebody got the message wrong, and it was actually around Chinese whispers come back and say, "Oh, Kathleen can do this," which I've no idea around it. But I think this is where society is. People just kind of grab onto one or two messages that go around. So you're available there to be able to have those conversations, to break those myths, really, that's happening.
So the consent link that's sent to the parents should contain the number for the base that looks after their school and also the email contact. And we are quite happy to have queries from parents, and
Mhm.
we'll do our very best to get back and help where we can.
Great, great. So we hear some of these vaccinations, and MMR is one of them that we kind of associate with babies. Measles, mumps, and rubella. I remember my children getting that a long time ago, but still babies are brought in for that. That is not just for babies. Can you explain a little bit more about that? Of why are we giving measles, mumps, and rubella again?
So MMR is re-offered to year 8 and 9 children who have missed or have an incomplete history of the MMR vaccination. And the UK schedule offers a routine MMR vaccine at 12 months and a second one when the child is 3.5 years old. So if any of these have been missed, this is what we re-offer in schools and in our clinics. So this is part of a catch-up program. So any of those children MMR it's really, really important that children have the measles, mumps, and rubella vaccination to reduce the chance of getting measles and mumps and rubella. So this is offered. This is one of the opportunistic visits, or not visits, of opportunistic vaccinations that we offer throughout the year during all of the programs except for the flu vaccination program, because that flu vaccination program is very, very busy. But even if there are some that consent at that time, we will try to capture them and offer the clinic appointments. But it's really important that MMR vaccination is taken on for the children if in year 8 and 9 if they have missed it in their childhood immunizations.
And that is
But
vital, isn't it? Sorry.
you are right, Kathleen. It
Mm,
is something that children normally have when they're small. And I think it can be quite confusing for parents when they get the consent link to
mhm,
say, oh, can you please consent for the measles, mumps, and rubella? When
mhm,
parents are thinking, is this something they should have again in year 8 and 9? But it isn't. It's only that they're flagged up as parents of children who have missed either one or both doses. They might be new to country, and in a lot of countries, the first dose of MMR is given before the age of 1. However, the UK schedule if it's given before the age of 1, that dose is not counted. So to be part of this schedule, the dose at
Mm.
age 1 and the dose at age 3.5, they're the 2 doses that count as being fully vaccinated. And also, if you've had them maybe privately or separately when your children were younger, some parents may have just had the measles vaccine on their own. Again, that is not considered to be part of the UK schedule, and those parents will be offered the choice to have the MMR and to get their children protected. But it is confusing, I agree.
So, and I know we've done other programs over the years on measles specific because we've had an outbreak in Birmingham and we tried to raise awareness of that previously. So it is important to get into the UK system so that people know where they are and, as professionals, where the children are based really to preempt something from like that from happening. Is that right?
Yes, that's right.
Yeah, I can see you nodding away there, and I'm sure our listeners
Yes.
are nodding away. It's important to get that information out to you. So there's lots of things that can happen to our children, listeners, and it's really important for you to be aware kind of the different systems. And you may have done it privately, or you may have come from another country. And I know a lot of our communities do come. They come into the UK, or they leave the UK and come back again, and they may have missed on those vital cut-offs, which you said was 1 year and over 1 year and 5 years, was it? Or did I get
It's
right?
3.5, just
Three and
before
a
they
half.
go to primary school.
Oh, thank you. Three and
If
a half.
parents receive a consent link and they know for definite their children have had 2 doses, we're quite happy for them to ring us with those 2 doses and we'll update the child's records. That's not a problem.
Oh, great. So, yeah, as long as you have that information, and I think most parents would have that information in their own records. It's just having to find those records indeed for that. So, are we better when we're talking about communities here and communities moving around in and out and communities maybe missing or maybe some of them has hesitancy in taking the vaccines? Are we getting better for communities like that, or is there still a poor uptake in taking vaccinations?
Well, nationally, it's reported that there is a decline in the uptake of routine vaccinations, and the national target would be 95% and above for herd immunity for the school leaver boosters. That's your diphtheria, tetanus, and polio, and your meningitis, ACWY, and for the HPV vaccination as well, and a 50% target for flu. The consequence of this is an increase in vaccine preventable diseases spreading within the population. So, whereas we would have had herd immunity or we would have eradicated measles in the past in the UK, it's not the case anymore with movement in or with parents deciding not to have the MMR. So, we've lost that herd immunity status. Vaccinations do save thousands of lives, and people should continue to get vaccinated unless there's a medical reason why that shouldn't happen.
Mm.
There's also, like you say, Kathleen, with misconceptions and reasons. And the biggest one we would find is the link with autism and the measles, mumps, and rubella vaccination, the MMR.
Mm.
And many years ago, there was a study that said that there was a link between the two. But when it was looked into thoroughly, that was totally disproven. And the doctor who had instigated it on a small number of people actually lost his medical license. And it was proven that there was no link between autism and the MMR. And all vaccines that are used in the UK are thoroughly tested. They meet strict safety criteria, and any reported side effects are monitored as well.
So that hopefully, inshallah, will reassure our listeners. And indeed, our listeners, we welcome you to do your own research and bring those queries to Sharen, to Yasmin, and to their colleagues that are here and want to discuss things with you in a more detailed presentation. Things. So, yeah, we do want people to know and be able to help and support you in giving those vaccinations. How else can we myth bust and protect people and get that correct information out there, because there's a lot. As I said, to give an example of, my little example here this morning, and messages going around and they're coming back as a different message. How can we get the correct message out there and keep myth busting those incorrect messages?
Well, as I say, the UK has a very strict medicine guideline that each vaccine is passed through strict safety checks, and it's extensively and continuously reviewed and monitored by a group called the MHRA, and that stands for Medicines and Healthcare Regulatory Agency. So they would be constantly looking at the vaccinations that we use. The flu vaccine aims to protect the vulnerable and the immunosuppressed people who have a low immune system for whatever reason. They may have had a transplant, they might be on chemotherapy drugs, and they contact the flu from children and young people. Mm-hmm. So we call our young people our super spreaders. Many people think they're young people, the children have a good immune system and they don't need the flu vaccine. But actually, they're the ones that when they get whatever bugs they get, we all know they spread them very quickly and generously to anyone around them. So if they actually get the flu vaccine, they not only protect themselves, they're protecting people at home, maybe grandparents who can't have the vaccine or anybody that's immunosuppressed. Immunocompromised children themselves are safe to have inactivated vaccines. And by that, I mean vaccines that are not live, that do not have the live virus in them. And that would be all of our injectable vaccines, including the flu. The nasal flu and the measles, mumps, and rubella are the only two live vaccinations, as in they would have a content of a weakened version of the virus within them to make a good immune response. Mm-hmm. And these children would not get the live vaccination if they were immunocompromised in any way. We would get advice from whoever looks after them in the hospital, their consultant, before we would give any live vaccines if we know from the parent that they have any condition that they shouldn't be having live vaccinations for.
Mm. So it's important to have that. And as you mentioned, young people often carry these things into the household. And in our communities, the extended family is really important. We might be all living together in the same household. And we not know that we're kind of spreading that virus or that bacteria, whatever it is that is causing that illness to from one person to the other. And we should really be more cautious around that. I know we're talking about the flu vaccine now, and we have about another 3 minutes left before we go into break. But it's let us just discuss that a little bit more, because although it's giving in the wintertime, I think more so, because we think of flu kind of autumn time, winter time, don't we, rather than springtime now going into summer. But flus, I suppose, happen different times of the year, do they? Or they can happen anytime, really. When do we mostly protect people against that flu? When is in your system that you kind of give those vaccines in your agenda?
So historically, we can see that the usual spike for flu cases is probably from mid-December until mid-January, which is why we would aim to start as soon as the vaccine's available, end of September. It takes a couple of weeks for anybody to build up a response to a vaccine. And in our planning of our schools, we would look to do the children in special schools first in case they have any extra vulnerabilities, then the primary school children who are our super spreaders, and then we'd move on to the senior schools, in the hope that by the time we come to the end of November, we've protected the majority of children and stopped them from bringing those bugs home, which would ease winter pressures for all of our hospitals and acute settings, in the hope that if anybody did eventually then get flu, that it would be less severe, they'd recover better, and they might not need a hospital admission. So that would be our aim, to start probably in the third week of September. And I've done most of our first visits to schools by the end of November to stop that spike and to help the cases to reduce.
Wonderful. So there's a program in there, and obviously it's set on facts and figures and where you started. I can see the way you systematically go through that process to eradicate this. Um, I think I would like to discuss some of the side effects of that, but we probably don't have time before the break. Just before the break, I know over the years there's been a lot of discussion around, flu vaccine and gelatine, and a lot of our community are worried about gelatine. So does the vaccine contain gelatine?
Before we come on to the gelatine, Kathleen, can I just say that all of the vaccinations that are given by the school age immunization service, there is no cost associated. So these are all free to the community around Birmingham and Solihull. So I think that was an important element to bring in here, just in case we didn't mention it, that
Okay.
none of these vaccinations, because some parents come from outside of the country and expect to pay for the vaccinations, but these are all free to the communities.
A really good point, Yasmin, to bring in there. And we can come back to the gelatine and the side effects after the break because we're actually going into a commercial break now. Time flies here, indeed, especially when we're trying to give out important information. So listeners, do tune in to us after this commercial break, inshallah. Get your pen and paper and take notes if you need. And we'll repeat some of these important facts again in the second